Pharmacology is the study of diseases, drugs, and their actions on living organisms, cells, microbes. The correct answer is option B, drugs and their actions on living organisms. Pharmacology deals with study of drugs, their sources, actions, and uses. The father of modern pharmacology is Rudolf Virchow, Claude Bernard, Oswald Schimmelberg, Alexander Fleming. The correct answer is option C, Oswald Schimmelberg is considered the father of modern pharmacology. Drug is defined as any substance used to cure diseases, chemical substance that affects living systems, food, supplement, vitamins only. The correct answer is option B, chemical substance that affects living system. A drug is any chemical that affects biological function. Pharmacokinetics means what drug does to the body, what body does to the drug classification, toxicity. The correct answer is option B. Pharmacokinetics includes absorption, distribution, metabolism, excretion. Pharmacodynamics means drug doses, what drug does to the body, drug excretion, drug absorption. Pharmacodynamics explains the mechanism and effects of drug on the body. Main organ for the drug metabolism is kidney, liver, lung, intestine. The correct answer is option B, liver. The liver is the primary site for drug metabolism. The main drug for drug excretion is kidney, liver, spleen, heart. The correct answer is option A, kidney. Most drugs are excreted through urine by the kidneys. Half-life of a drug means time to absorb drug, time to reduce plasma concentration by half, time for excretion, duration of action. The correct answer is option B, time to reduce plasma concentration by half. Half-life is the time taken for plasma concentration to reduce by 50%. The study of harmful effects of drug is called toxicology, pathology, microbiology, physiology. The correct answer is option B, toxicology. Toxicology deals with adverse effects and poisons caused by drugs. Route of administration bypassing the liver is oral, sublingual, rectal, buccal. The correct answer is option B, sublingual. Sublingual route avoids first pass metabolism in the liver. The process of drug movement from site of administration to blood is absorption, distribution, metabolism, excretion. The correct answer is option A, absorption. Absorption is the entry of a drug into systemic circulation. Bioavailability means total amount of drug given, fraction of drug that reaches systemic circulation unchanged, drug metabolized, drug absorbed. The correct answer is option B, fraction of drug that reaches systemic circulation unchanged. Bioavailability represents the percentage of administered drug available for action. The blood-brain barrier prevents lipid-soluble drugs, water-soluble drugs, all drugs, none. The correct answer is option B, water-soluble drugs. Only lipid-soluble drugs cross the blood-brain barrier easily. Drugs given by oral route undergo first pass metabolism, no metabolism, rapid excretion, local action. The correct answer is option A, first pass metabolism. Drug absorbed from the gut first go through the liver where they may be metabolized. Drug receptors are usually lipids, proteins, carbohydrates, nucleic acids. Correct answer is option B, protein. Most drugs receptors are specific proteins on cell membranes. Agonists are blockers, activators of receptors, antagonist, none. The correct answer is option B, activators of receptors. Agonists activate receptors to produce a response. Antagonists are receptor activators, receptor blockers, enzyme induces hormones. The correct answer is option B, receptor blockers. Antagonist binds to receptor but block the effect of agonist. Tolerance means decreased response after repeated use, increased effect, adverse reaction, and the correct answer is option A, decreased response after repeated use. Tolerance occurs when the body adapts to a drug, reducing its effects. Tachyphylaxis is gradual decrease in drug effect, rapid decrease after repeated doses, toxicity. None. The correct answer is option B, rapid decrease after repeat doses. Tachyphylaxis is a rapid decrease in response due to continuous drug exposure. The safest route of drug administration is oral, intravenous, intramuscular, subcutaneous. The correct answer is option A, oral. Oral route is simple, convenient, and non-invasive. The study of drug dose and its relationship to the effect is called option A, pharmacodynamics. Option B, pharmacokinetics. Posology, toxicology. The correct answer is option C, posology. Posology is a branch of pharmacology deals with dosages. The science deals with poisons is pharmacology, toxicology, pathology, microbiology. The correct answer is option B, toxicology. Toxicology studies the harmful or toxic effects of substances. Drug dependence is habit forming behavior, physical or psychological craving for a drug. Tolerance, none. The correct answer is option B, physical or psychological craving for a drug. Dependence is when withdrawal leads to symptoms or craving. The first pass effect occurs mainly with oral route, sublingual route, IV route, intramuscular route. The correct answer is option A, oral route. Drugs given to orally pass through the liver before reaching systemic circulation. The process by which drug concentration decreases in plasma due to metabolism is excretion, metabolism, absorption, elimination. The correct answer is option B, metabolism. Liver enzymes modify the drug for easier elimination. Drugs that stimulate the CNS are depressants, stimulants, sedatives, narcotics. The correct answer is option B, stimulants. CNS stimulants increase alertness and activity. Example, caffeine, amphetamine. Drugs that slow down brain activity are stimulant, depressants, hallucinogens, Drugs that slow down brain activity are stimulant, depressants, hallucinogens, antagonists. The correct answer is option B. Depressants. CNS depressants like barbiturates and benzodiazepines reduce activity. The therapeutic index of a drug indicates safety margin, efficacy, toxicity, metabolism. The correct answer is option A, safety margin. Higher therapeutic index is equal to safer drug. Idiosyncrasy means expected effect, unusual or abnormal reaction to a drug, dose related effect. D. Option D, tolerance. The correct answer is option B, unusual or abnormal reaction to the drug. Idiosyncratic reactions are unpredictable, genetically determined responses. Teratogenic drug causes cancer, birth defects, allergy, vomiting. The correct answer is option B, birth defects. Teratogenic drugs harms the fetus. Example, thalidomide. Drug allergy is caused by immune response, overdose, drugs toxicity. None. The correct answer is option A, immune response. Allergic reactions occur when immune system overreact to a drug. Cumulative effect occurs when drug accumulates in the body, drug excreted rapidly, dose reduced. None. The correct answer is option A, drug accumulates in the body when a drug is given repeatedly before previous doses are eliminated. The time required for the onset of drug action is least in oral, intramuscular, intravenous, subcutaneous. The correct answer is option C, intravenous. Intravenous route gives immediate action as the drug enters circulation directly. Sustained release tablet is designed to act immediately, release drug slowly over time, release drug in stomach only, reduce side effects. The correct answer is option B, release drug slowly over time. Sustained release maintains blood level for long periods. A placebo is a real drug, a inactive substance used for control, a toxin, antibiotic. The correct answer is option B, an inactive substance used for control. Placebo has no pharmacological effect used in clinical trials. Drug synergism means two drugs decrease each other's effect, two drugs enhance each other's effect, no effect to toxic reaction. The correct answer is option B. Two drugs enhance each other's effect. Synergism occurs when combined drugs produce a greater effect. Drug antagonism means two drugs cancel each other's effect, addictive effect, increased toxicity, no effect. The correct answer is option A. Two drugs cancel each other's effect. One drug reduces or blocks the effect of another. The unit of drug potency is gram, microgram or international units, liter, mole. The correct answer is option B, microgram or international unit. Potency is measured by minimal dose required to produce an effect. A drug used to relieve pain is antipyretic, analgesic, sedative, antibiotic. The correct answer is option B, analgesics. Analgesics reduce pain without loss of consciousness. Paracetamol act as a analgesics and antipyretic, antibiotic, antihistamine, anesthetics. The correct answer is option A, analgesics and antipyretic. Paracetamol relieves pain and fever. Aspirin is contraindicated in hypertension, peptic ulcer, fever, headache. The correct answer is option B, peptic ulcer. Aspirin irritates gastric mucosa and can cause bleeding. The antidote for morphine poisoning is atropine, naloxone, diazepam, neostigmine. The correct answer is option B, naloxone. Naloxone reverses opioid effects. The example of local anesthetic is paracetamol, lignocaine, diazepam, codeine. The correct answer is option B, lignocaine. Lignocaine blocks nerve conduction locally. The drug used to reduce fever is called antipyretic, analgesic, sedative, antibiotic. The correct answer is option A, antipyretic. Antipyretics lower elevated body temperature. Anti-acid drugs act by neutralizing gastric acid, producing more acid, increasing motility, causing diarrhea. The correct answer is option A, neutralizing gastric acid. Anti-acid neutralizes HCl and relieve acidity. A drug that induces sleep is analgesic, sedative, hypnotic, antipyretic. The correct answer is option C, hypnotic. Hypnotics promote sleep. Benzodiazepines are used as anti-anxiety drugs, antibiotics, anti-acid vitamins. The correct answer is option A, anti-anxiety drugs. Benzodiazepines like diazepam release anxiety and cause sedation. Antibiotics act by killing or inhibiting microorganisms, stimulating immunity, reducing pain. None. The correct answer is option A, killing or inhibiting microorganism. Antibiotics destroy bacteria or inhibit their growth. The first antibiotic discovered was streptomycin, penicillin, tetracycline, chloramphenicol. The correct answer is option B, penicillin, discovered by Alexander Fleming in 1928. Broad spectrum antibiotic act against only gram positive, only gram negative, both gram positive and gram negative. None of the correct answer is option C, both gram positive and gram negative. Broad spectrum antibiotics cover a wide range of bacteria. The main use of diuretic is to increase blood pressure, reduce urine output, increase heart rate. The correct answer is option C, increase urine output. Diuretics increases excretion of water and sodium from the body. Furosemide is a loop diuretic, thiazide, potassium sparing diuretic, osmotic diuretic. The correct answer is option A, loop diuretic. Furosemide act on loop of the Henle to increase urine flow. The main adverse effect of loop diuretics is hyperkalemia, hypokalemia, hyperglycemia, bradycardia. The correct answer is option B, hypokalemia. Loop diuretics cause potassium loss leading to hypokalemia. Digoxin is used in diabetics, heart failure, asthma, tuberculosis. The correct answer is option B, heart failure. Digoxin improves heart contraction and slows heart rate. Signs of digoxin toxicity include diarrhea, nausea, visual disturbances, fever, rash, cough. The correct answer is option A, diarrhea, nausea, and visual disturbances. Toxicity causes nausea, vomiting, and yellow vision, xanthopsia. Beta blockers act by stimulating blocking beta receptors, increasing heart rate, causing bronchodilation. The correct answer is option B, blocking beta receptors. Beta blockers reduce heart rate and blood pressure. Example of beta blocker: atenolol, furosemide, insulin, diazepam. The correct answer is option A, atenolol. Atenolol is a cardio-selective beta blocker. ACE inhibitors are used for hypertension and heart failure, diabetes, infections, allergy. The correct answer is option A, hypertension and heart failure. ACE inhibitors like enalapril lowers blood pressure. Side effect of ACE inhibitors: cough, constipation, drowsiness, blurred vision. The correct answer is option A, cough. Persistent dry cough is a common side effect. Nitroglycerin is used in asthma, angina pectoris, diabetes, epilepsy. The correct answer is option B, angina pectoris. Nitroglycerin dilates coronary arteries and relieves chest pain. Insulin is used in the treatment of hypertension, diabetes mellitus, anemia, heart failure. The correct answer is option B, diabetes mellitus. Insulin lowers blood glucose level. Oral hypoglycemic drugs are used in type 1 diabetes, type 2 diabetes, both types hypoglycemia. The correct answer is option B, type 2 diabetes. Used in type 2 diabetes to increase insulin action. Metformin belongs to sulfonylureas, biguanides, thiazolidinediones, insulin analogs. The correct answer is option B. Metformin decreases hepatic glucose production. Glucagon is used in hyperglycemia, hypertension, none. The correct answer is option B, hypoglycemia. Glucagon increases blood sugar level in emergencies. The thyroid hormone increases metabolism, digestion only, blood clotting, sleep. The correct answer is option B, metabolism. Thyroxine controls metabolism and energy production. Hypothyroidism is treated with levothyroxine, insulin, adrenaline, and estrogen. The correct answer is option A. Levothyroxine replaces deficient thyroid hormone. Corticosteroids are used for inflammation, infections, fever, diabetes. The correct answer is option A, inflammation. Steroid like prednisolone reduce inflammation and immune response. Long-term use of steroid causes weight loss, Cushing syndrome, low blood sugar. None. The correct answer is option B, Cushing syndrome. Prolonged steroid use can cause Cushing features. Antibiotics should be used only under medical supervision for viral infections to reduce fever only daily without advice. The correct answer is option A, only under medical supervision. Misuse of antibiotic causes resistance. Penicillin allergy may cause rash and anaphylaxis. Diarrhea only, fever only, headache. The correct answer is option A, rash and anaphylaxis. Penicillin may cause severe allergic reactions. Tetracycline should not be given to adults, pregnant women, and children, males and elderly. The correct answer is option B, pregnant women and children. It causes teeth discoloration and bone defects in children. Aminoglycosides can cause nephrotoxicity and ototoxicity, hypertension, cough, constipation. The correct answer is option A, nephrotoxicity and ototoxicity. Aminoglycosides may damage kidney and hearing. Rifampicin is used to treat typhoid, tuberculosis, malaria, fungal infection. The correct answer is option B, tuberculosis. Rifampicin is a first-line anti-TB drug. A common side effect of rifampicin: red-orange discoloration of urine, constipation, hair loss, cough. The correct answer is option A, red-orange discoloration of urine. Rifampicin colors body fluids orange, red. Antifungal drug example: fluconazole, ciprofloxacin, rifampicin, amoxicillin. The correct answer is option A, fluconazole. Fluconazole treat fungal infections. And oseltamivir. Vaccine works by killing germs directly, stimulating the immune system, acting as an antibiotic, producing toxins. The correct answer is option B, stimulating immune system. Adrenaline is used in hypotension and anaphylactic shock. Hypertension, fever, asthma only. The correct answer is option A, hypotension and anaphylactic shock. Adrenaline raises blood pressure and opens airway. Adverse effect of adrenaline: palpitation and anxiety, drowsiness, diarrhea. And the correct answer is option A, palpitation and anxiety. Overdose causes increased heart rate and tremors. Drug used for asthma attack: salbutamol, atropine, diazepam, furosemide. The correct answer is option A, salbutamol. Salbutamol is a bronchodilator used in asthma. Antihistamines are used to treat allergy, fever, infection, diabetic. The correct answer is option A. They block histamine and reduce allergic symptoms. Example of antihistamine: cetirizine, insulin, metformin, furosemide. The correct answer is option A. Cetirizine. Cetirizine relieves sneezing and itching. The drug used to prevent nausea and vomiting. Antiemetic, analgesics, antipyretic, antibiotic. The correct answer is option A. Antiemetic. Antiemetics control vomiting. Example: ondansetron. Laxatives are used to relieve constipation, stop diarrhea, reduce pain, lower fever. The correct answer is option relieves constipation. Laxatives promote bowel movement. Antidiarrheal drug example: loperamide, bisoconazole, lactulose desoxin. Antidiarrheal drug example: loperamide, bisoconazole, lactulose desoxin. The correct answer is option A. Loperamide. Loperamide reduces intestinal motility. Iron supplements are used in anemia, diabetes, hypertension, infection. The correct answer is option A. Anemia. Iron increases hemoglobin in anemic patient. Vitamin K is essential for vision, blood clotting, bone growth, nerve function. The correct answer is option B. Blood clotting. It helps synthesize clotting factors. Adverse drug reactions means harmful unintended effect of drug. Expected effect: overdose, allergy only. The correct answer is option A. Harmful unintended effect of drug. Adverse drug reaction means harmful unintended effect of drug. Expected effect: overdose, allergy only. The correct answer is option A. Adverse drug reaction: unwanted effects occurring at normal doses. The nurse should always check right patient, right dose, right route and time. The only drug name, only route, none. The correct answer is option A. These are the 5 rights of medication administration. Expired drugs should be used carefully, discarded safely, given to others, stored again. The correct answer is option B is discarded safely. Expired drugs lose potency and may be toxic. The term polypharmacy means use of multiple drugs, single drug use, herbal use. Adverse effect: the correct answer is option A. Use of multiple drugs, common in elderly due to multiple conditions. Drugs give via rectal route, have local or systemic effect, only local effect, only systemic, none. The correct answer is option A. Have local or systemic effect. Suppositories may act locally, laxative or systemically. Parenteral route means through the GIT tract, bypassing gastrointestinal tract, oral route, rectal route. The correct answer is option B. Bypassing GI tract. Includes IV, IM, SC, intradermal injection, intravenous, intramuscular, subcutaneous. The main disadvantages of IV route: slow effect, pain and risk of infection, poor absorption, unstable drug. The correct answer is option B. Pain and risk of infection. IV administration carries risk of infection and pain. Drug store Drugs stored in light resistant containers are photosensitive drugs, thermostable drugs, water soluble drugs, all drugs. The correct answer is option A. Photosensitive drug. Light may decompose some drugs. The nurse should report any adverse drug reaction immediately, minor effects later, ignore mild symptoms, none. The correct answer is option A. Adverse drug reaction immediately. Timely reporting prevents serious outcomes. The abbreviation OD means twice daily, once daily, 4 times daily, every 4 hours. The correct answer is option B. Once daily. OD stands for once daily. The abbreviation TDS means once daily, twice daily, 3 times daily, every 6 hours. The correct answer is option C. 3 times daily. TDS means tertai sumendum, 3 times a day. The abbreviation TDS means once daily, twice daily, 3 times daily, every 6 hours. The correct answer is option C. 3 times a day. Daily. TDS means third day. Sumendum, 3 times a day. The abbreviation PRN means as needed, after meals, before meals, immediately. The correct answer is option A. As needed. PRN means as required, pro re nata. Pharmacovigilance refers to monitoring drug safety and adverse effect, drug manufacturing, clinical trial only, marketing drugs. The correct answer is option A. Monitoring drug safety and adverse effect. Pharmacovigilance detects, assesses and prevents adverse effects. Thank you all.